Hi, my name is Nagar Memari, and my topic for my presentation is staffing in hospital and long-term care facilities. Hospital nurse staffing is a concern because of the effects of shortage has on patient safety and quality of care. So objectives for this presentation are research on relationship between staffing and quality of care for patients, stats on 2016 registered nurses cuts and the effect on nurse burnout, patient adverse outcomes, stress related to shortage of staffing, signs and symptoms of burnout, adverse events related to burnout and sleepiness, nurse staffing and job satisfaction, conclusion, and what can be done next. Some stats. From January 2016 to February 2016, within a 4-week period, 775 cuts were made. And that's just in Ontario. Equivalent to loss of almost 1 million hour frontline RN care for patients. Ontario has 711 RNs per 100,000 people compared to an average of 841 per 100,000 people to the rest of Canada. Nurse-patient ratio. Ratios can be used to better understand staffing levels between different areas of healthcare facility and examine relationship between staffing and safety, quality of care, value for money, and the health of the workplace. I have a data here to show you, and in this data shows that in Canada, the nursing unit with the highest nurse to patient ratio is intensive care unit, and the lowest ratio is long-term care. So with most intensive care units, they're one-on-one, one nurse for one patient, and the highest ones are one nurse in long-term care for as high as 9 patients. Potential outcomes from inadequate staffing is patients can develop UTIs, pneumonia, longer hospital stays, failure to rescue, and decreased amounts of purposeful rounds. Lower nurse-patient ratios, according to a study of 5 million patients, has shown that 3 to 12% reduction in adverse outcomes and lower rates of complications, increased quality of care for patients, decreased medication errors, allows hourly rounding, better communication among healthcare professionals. It is important that ratios are flexible according to patients' needs and lower patient assignments when patients require more care. For example, in medicine unit, North Bay Regional Health Center, where I'm doing my preceptorship, nurses do get less amount of patients when they have patients who need higher care, more care. Effects on the staff. So, the term burnout was coined in the 1970s by American psychologist. He used to describe the consequences of severe stress and high ideals experienced by people working in helping professions, such as doctors and nurses, who sacrifice themselves for others and often end up being burnt out, exhausted. Burnout is considered to have a range of symptoms. There is no agreement which of those are part of it and which ones are not. So there is, as explained, there are emotional exhaustion, where the nurse would feel drained and exhausted, overloaded, tired, and do not have enough energy. Alienation from job-related activities. People affected find their jobs increasingly negative and frustrating, may develop negative attitude towards their job and colleagues. They may also distance themselves emotionally and disengage from work. and also they might also see reduced performance. This may affect their everyday tasks at work as well as home caring for their family nurses. Nurses experiencing burnout find it difficult to concentrate and experience a lack of creativity. They also, with burnout, stress will also increase, and stress will include cognitive stress. So they might experience memory problems, inability to concentrate, poor judgment, trouble thinking, anxious or racing thoughts, and loss of objectivity. There's also physical stress, the headaches, backaches, muscle tension, and stiffness, insomnia, increased pulse, weight gain, and decreased immune system. Emotional stress will include agitation, restlessness, loss of patience, irritability, overwhelm, depression, and sense of loneliness. And there's also behavioral stress, which will include neglecting responsibilities and pacing. Adverse event related to burnout in nurses are medication errors and also risk own health and safety. Sleep deprivation or burnout has an adverse effect on performance of hospital staff nurses. Several studies have shown that failure to obtain adequate sleep is an important contributor to medical error. Nurses who reported an error or near miss obtained significantly less sleep than nurses who did not report an error or near miss. They may also, less sleep also will increase the risk of own health and safety for the nurses. Sleep loss is the leading cause of drowsy driving and related vehicle crashes. Reduced information processing deficits, which make it respond slower to hazards. And also lack of sleep up to 20 hours can produce decreases of performance equivalent to blood alcohol concentration of 0.01%. It can also impair hand-eye coordination, decision-making, and memory and speed. I strongly believe that the first issue that has been affecting better care is staffing in healthcare facilities. Shortage of nursing staff results in staying extra hours of work under stressful conditions, which can result in fatigue, injury, and job dissatisfaction. Nurses suffering in this kind of working environments are more prone to making mistakes and medical errors. Safe nurse staffing, meaning an appropriate number of nurses and other staff is available at all times, providing care with a suitable mix of education, skills, and experience to ensure patient needs are met in safe and timely manner. Adequate number of nursing staff has been proven to strengthen patient care and safety. With more staff, patient satisfaction and quality of care will also be increased. What can we do next? More nurses will lead to better patient outcomes to improve nurse staffing. Hospitals need money to pay more staff, and more nurses are in need in the labor of the market. Thank you very much.